Hey y'all, Dr. T. It's Saturday. I'm in Boulder, Colorado. Moved my son here a couple of days ago. He's gonna start attending University of Colorado at Boulder. So, kind of interesting little segue. He's having some kind of life changes and getting kind of back to, or getting kind of for him getting started on his new life. And so I wanted to talk about a couple of things. One is there was recently a post, a news flash about a certain company that is or basically settling some lawsuits on Essure. This is huge news, obviously, for those women that have been affected. This is huge news for the women that started the Essure group years ago, and for all the women that have suffered or are suffering with side effects from bleeding to pain to autoimmune diseases and anything else. So I wanted to get out and talk about the Essure coils themselves and how to properly do a salpingectomy. And I say salpingectomy specifically because, yes, Brandy, I think that you were heard, and hats off to Angie Fermalino because, I mean, she's the one that kind of started this all. So I would like to just kind of talk about salpingectomy real quick because salpingectomies are getting done at an alarming rate, which is great. However, nobody's doing x-rays. I have yet to find a doctor that does an intraoperative x-ray, meaning an x-ray in the OR during the case. If you're having a salpingectomy done, and I don't care who's doing it, if they are wonderful and they're the only doctor that's helping in your neck of the woods, if they're not doing an x-ray during the surgery after the coils are removed, how can they 100% tell you that the entire thing has been removed? If you're not getting the x-ray beforehand, how do they know how many you have? How do they know where they are? So you need to have two x-rays if you're having a salpingectomy. If you're having just the tubes removed to have the coils taken out, they need to do an x-ray during the surgery or they'll never be able to tell you if they got all the pieces out. There's a lot of doctors out there. There's some doctors that have done a bunch of them, maybe 100, and they're not doing x-rays. So how many of those 100 women have pieces left behind? My guess, and this is just a guess, but I would say probably 5 to 8% of the salpingectomies that are being done without x-rays probably have pieces left behind. If you are a woman that has had a salpingectomy to have a coil removed and you didn't have an x-ray during your surgery and you don't know, get a copy of your operative note. It would have been dictated in the operative note. If it's not dictated in that operative note that you had an x-ray during the surgery, then call your doctor and tell him you want an x-ray just to make sure there's no pieces in your pelvis. Chances are there aren't, but in a few select women, there may be pieces left behind. I've done 800 of these, and I've had 2 cases where I left pieces behind and subsequently had to redo everything while I was still in the OR because I knew that I had to go back in. But if I wouldn't have done that, how would I know that the pieces were left behind? So that being said, we need to make sure that it's just being done correctly because you only want to have one surgery. And a newsflash, you don't have to have a hysterectomy. Now, you can have a hysterectomy, and it's a fine way to remove the coils if you're having serious problems with bleeding or pelvic pain, or you're just 50 and you don't want, if you're going to have surgery, you just would rather have the uterus removed, then that's fine. There's also some confusion between a removal and a reversal. A removal is actually having the coils removed, most likely with the tube intact. A reversal is where the coil is removed from the tube and the remaining piece of tube is reattached back to the uterus so that you can get pregnant. Removal is covered by the by insurance. Reversals are not. Well, come on out, Queen. I'm waiting. I'm here. I'm in Boulder right now, but I'll be in Austin next week. Lastly, a lot of women that have coils, and a lot of women in general, have hormone imbalances. But the number one thing that I'm seeing with women that have the Essure coils is estrogen dominance. And on top of that, sometimes low progesterone and low testosterone. So what I'm seeing are women with insomnia, breast tenderness, irritability, heavy periods, painful periods, weight gain from insulin resistance, fatigue, especially in the afternoons, decreased libido. If this sounds like your typical Saturday, which wouldn't be any fun, but all we have to do is check your hormones, and I can do that from anywhere in the country. All you have to do is call the office at 512-956-0296 and make an appointment. I can order labs anywhere. I can interpret the labs from anywhere as well. Digging the coil out is what the surgery should be. So to have a salpingectomy, you should have what's called, this is my opinion, my medical opinion, but I've done a bunch of these. You should have a bilateral salpingectomy with a partial cornuectomy where the Da Vinci is used. It has to be done with the Da Vinci, and I will explain why. But you have to core around the coil, leaving pieces of the uterine tissue all the way down into the cavity of the uterus so that you can get it all out in one piece. It all comes out still in the tube, and you're also removing the part that was in the uterus by cutting around it. You can't do that with regular straight stick laparoscopy. It would be almost impossible. It would take hours to get that out of there. So it would be with the Da Vinci, and then you put stitches in the corner of the uterus, and then you do an x-ray. Again, have to have an x-ray. I can't tell you how many women I've spoken to that didn't get an x-ray during the case. The doctor either told them it wasn't necessary, they told them, or they just didn't do it at all. Now, I've got women that get angry with me because they've already had the surgery and they're like, well, my doctor's good and I'm not saying anybody's not good. What I'm saying is if you want to be thorough, if you want your doctor to be thorough and make sure that you have no fragments left behind and you're having a salpingectomy, then do an x-ray during the surgery. It's so easy. It takes 5 minutes to do it. Can you please do a video explaining the higher risk of ectopic after Essure reversal? That is just... Higher risk of ectopic after Essure reversal is pretty much the same as tubal reversal anyways. We know that tubal reversals in general, whether it's an Essure reversal or any other type of tubal reversal, simply because you're putting the tube back together and there's a spot in the tube where it's been damaged because you had to cut it and put stitches in it. So that alone raises the risk of ectopic pregnancy. I've seen them pull the coil out after digging. Yeah, that you can't... if you're going to be pulling, don't pull on the coil. If you cut around it and just hold it and cut around it, what I do is you cut around the area you want where the coil is, and then you put the scissors and you push and you spread and you push and you spread and you keep going down farther and farther. And you just hold it in place. Once you get down into the uterine cavity, everything comes out in one piece. I can do it in about 35 minutes because I've done hundreds and hundreds of them, but you don't want to be in somebody's first 10 or 20 cases. You just don't. You can come out to Austin. I know it's a pain in the butt, but it's one trip. I do everything preoperatively on the phone. You come out and have the surgery, just like Monteith when he does reversals. It's one visit, and then it's insurance. And 95% of the cases I do, salpingectomy-wise, are Essure related, are paid by insurance. Why would you pay... to have it done? You don't need to. Miss Hillier there came from Canada. So people do make the trip to Austin all the time. And I hate to say it, but I think it's worth having it done right the first time. I know there's beloved doctors that are on lists out there that say that they've helped so many women, and that's great. If they're doing hysterectomies, that's awesome. That does help. But if they're doing salpingectomies, the first question in these groups, in these Facebook groups that needs and is begging to be asked is, are they doing an x-ray during the case? If they're not, then how do you know it's all out? How do you have any clue that it's out? You don't. You literally do not. You have no idea. You are basically going on the fact that they did a good job, and that's fine. There's a lot of good doctors out there, but even I've done hundreds, and I've had a couple that it was left behind, and I had to go back and grab it before we left the operating room. And that's doing a bunch. So imagine somebody that's done 30 cases, 20 cases. Yes, they're going to leave pieces behind. It's going to happen. Even if it's done properly, it's going to happen. But if you do the x-ray, you catch it, and then you'll never have to have another surgery again. So other things are, doctors, if they tell you they can't do an x-ray, that's a bunch of crap. They can do an x-ray. It's physically possible. And if they can't do an x-ray, then do it somewhere else. Simple. If they're telling you that the insurance won't cover it, they'll only cover hysterectomy, garbage. Not true. Doesn't happen. I take them out all the time, and insurance covers it. Even state Medicaid plans will cover it. Does anybody have any questions about Essure removal or hormones? I'm just sitting in my hotel room in Boulder, Colorado. I left the heat of Austin. It was 106, 105. I get to Boulder. It's 97 here, and it's 90 in Austin. So that's great. I mean, you go somewhere, it's usually in the 80s here, and now it's 97, and it's cooler in Austin. So any other questions anybody has for me about Essure related? So basically, we just focused on salpingectomy. What's the one thing we learned about salpingectomy? Get an x-ray. Get an x-ray before and get an x-ray during the surgery. Your doctor needs to do an x-ray during the surgery, and you need to have what's called a bilateral salpingectomy partial cornuectomy, meaning we're coring around the coil with the Da Vinci down into the uterine cavity to remove it all in one piece. Still doing ablations. I have done probably 3 ablations in the last 5 years, I would guess. Occasionally, an ablation is helpful, especially in a woman that doesn't have pelvic pain or pain with her periods. But if she does have pain with her periods, then an ablation wouldn't be a good idea. Yep, Jennifer, I'm here. You know where to find me. Thank you, Tia. That's wonderful. Yeah, if you can share this to any of the other groups. I know it can be political sometimes, and maybe they'll take it down. But the more that you can, you don't need birth control after removal because you don't have fallopian tubes. So the chances of you getting pregnant would be the same as they were having your tubes tied. It's going to be about 1 in 1,000. That wouldn't change. You don't need birth control after you have the tubes removed. So that's a good question. But yeah, you would the pregnancy rates would be the same as if you just had your tubes tied. So yes, I know. I didn't want to say your name because of privacy, but you said it. So yeah, if you could share this to other groups so that I know, that would be great. Thanks, Brandy, for sharing those. I know sometimes I might come across as a little blunt. It's just that, it's funny, and Angie Fermalino could probably be this way too. I've been on this boat for probably 6 years, and it's been really frustrating for me, and I don't even have the coils put in. I can't imagine what it's like for y'all. But what's even more frustrating for me is I know how to do this the right way because I've done it. I'm kind of the one that did this. And I've suffered as well. I've suffered some things in my private life, and my practice has suffered because I stayed with this, and I had to start over a couple of times. So, but I believe in it, and I believe it needs to be done the right way. And I believe that what I have created by getting an x-ray before, doing the partial salpingectomy, cornuectomy with an x-ray during is the proper way to do it after doing over 800 removals. That's the right way to do it. Now, I don't have a paper because I'm not an academic person. I wrote a book chapter with Eric Sills a while back, and I wrote the chapter in the book on it, on the partial salpingectomy. That was when I had about 350 cases. And so I just wish that everybody could share this and do as they go forward, especially now because it's going to get some attention because of the settlement, and women that maybe don't have issues or haven't made the connection that some of their issues could be from the coils, they may rush to have these removed. And there may be doctors out there that are just saying, okay, I'll do it, and they don't really know what they're doing. So besides having the x-rays done, one thing that I would like for you to do when you go into your doctor, have them, well, you can always ask them how many they've done, but you can kind of fudge that. Doctors can just say, oh, I've done a bunch. Make them draw you a picture how they're going to get the coils out of the tubes. Make them draw you a picture also of how they're going to remove the tubes from the uterus. If they say anything about cutting the tube open and pulling, find somebody else. If they say anything about cutting the tube off of the uterus, go find somebody else. What you want is someone that's going to core around the coil down into the muscle of the uterus and leave a defect in the corner so that you have a tube and coil all in one piece that you're sending to pathology. And if you don't have somebody that's doing that, then you might have pieces left behind. Those microfibers, those PET fibers, you really have to core around them to make sure. And even then, you can't guarantee it because we can't see them. But like I said, I've done enough of these to know what's right and what's wrong. And again, my medical opinion, but I would defend this till I'm blue in the face, that I think that you certainly don't want somebody cutting the tube open and pulling on them. You don't want them taking them out hysteroscopically where they go into the uterus and they grab it and they just pull it out, which I've seen. I've seen disasters. And if you have a hysterectomy, you don't want a vaginal hysterectomy. You want laparoscopic assisted hysterectomy. It could be laparoscopic assisted vaginal. It could be laparoscopic assisted, a total laparoscopic assisted hysterectomy. But you don't want a straight vaginal hysterectomy because it's almost impossible to leave the tube attached to the uterus, meaning they have to cut it off. So like I said, a lot of women will be going to probably their OBGYNs when they find out that Bayer is considering settling. At least that's what it says. I am not an authority on this. I'm just talking about what I've read, that they've set aside $1.6 billion to settle this. There were 39,000 plus women that were in this deal, but I do feel like when this comes out, that there's going to be a lot of women out there that do call their doctors that have the coils that either weren't making the connection, that maybe their migraines, maybe their nickel allergies, maybe their skin disorders, their autoimmune diseases like Hashimoto's, lupus, their heavy bleeding or pelvic pain could possibly be related. And I just think it's time that we do it the right way. Also, as Marla said, she had an amazing doctor and had a laparoscopic hysterectomy. If you have a hysterectomy, you still need an x-ray before the surgery. So otherwise, how do they know? I've seen 5 coils. I've seen 3 coils. If they don't do a preoperative x-ray, they don't know how many there are and they don't know where they are. I've found coils up by the stomach before. I have found them way up over on the right side, on the left side. So you need to have an x-ray prior to the surgery, regardless of whether you're having a salpingectomy or a hysterectomy. The other thing is be a voice for women that still don't know. Be kind and challenge the paradigm. Keep challenging the paradigm. I think there's a way to challenge doctors and to not do it in such a way that they become obstinate and negative. There's persistence. I don't know the specifics, Jennifer, about unfortunately, about the legal side of things. I'm kind of talking about the medical side of stuff because that's kind of my area. Unfortunately, you can call attorneys and maybe find out about that, but I know there were like 39,000 women in there. It is still a win for every woman because there will be women that come after all of this that are making connections and maybe they're not part of a settlement, but they need to know. They need to know. There were at least 1 million of these things put in. So we need to be a voice. And now, watching the bleeding edge, I'm a little bit conflicted about the bleeding edge because I think it was a little bit grandiose. I think they did a couple of things that were good and they did some things that were bad. Going after the intuitive robot was just stupid. The case that they talked about where they had a vaginal cuff that opened up. That happened. That's not the Da Vinci's fault. That's the surgeon's fault. The Da Vinci's a device. It does what you tell it to do. So if the sutures broke open, that's not the machine's fault. That's the doctor that's doing it fault. So yeah, it's one of those things where watch it with a grain of salt. It did bring up some good points. It got people motivated, but I do think it was a little bit over the top. And unfortunately, those of us out there that were doing the work were not included in the movie. And we weren't included because we decided we weren't going to be hatchet people against the company. I have absolutely no desire to speak badly about them. I'm just trying to tell you guys, you women, what I see and how I think that it needs to be done properly. But it's one of those things that I think would be great to keep going and keep pushing, because just because there's a settlement doesn't mean there aren't a lot of your fellow sisters out there that are having problems and they don't know where to find help, and they're logging on to the Facebook pages, and you can be a beacon of aid for them. You can push them to get x-rays. You can push them away from people that are kind of just not really. There's well-meaning physicians out there, granted, they really are. They're doing their best that they can with what they know, but if they don't know how to do it, I don't know how to do a lymph node dissection on a cancer patient. I'm not going to do it. Well, this is a difficult procedure. It's not super easy, and that's part of the problem. Is I think it's thought of by a lot of physicians as just being easy to do. You know, it's like, oh, we're just going to go in and we're going to pull these things out. That's not how you do it. It's not that easy. It comes from expertise. It comes from doing it. And so push these women towards providers that are good, not just doctors that want to help. Unfortunately, that sounds horrible. But some of the doctors that want to help really believe they're helping and they know what they're doing, but they just haven't done it before and they're not helping sometimes. So we want to make sure. What do I ask for to check for autoimmune disorders? There is no test for autoimmune disorders per se. You can check for lupus, you can check for Hashimoto's. You can check for autoimmune disorders by checking antibodies to the disorder that you're looking for. So like if you're looking for Hashimoto's, you check thyroid peroxidase antibodies or thyroglobulin antibodies. So the antibody testing is specific to the autoimmune disease you're looking at. There is no one test for like an autoimmune disease. It doesn't exist. But mainly what we're looking at is just inflammation. So inflammation is key with these coils. Inflammation is key with autoimmune disorders. Inflammation is key, and we can cut down on that by the things that we eat: no dairy, no gluten, trying to use proper supplements like something I like called Zyflamend, which has holy basil, turmeric, and rosemary in it. It's a really good anti-inflammatory. And then removing the offending agent. You got to remove the offending agent, which would be the coil. It's a foreign body. It causes a foreign body reaction. If you had a toothpick stuck in your leg, this is funny. So if you had a toothpick stuck in your leg and you went to the doctor and you said, hey, I've got this toothpick stuck in my leg and I got it put in 2006. And you know, it just hurts. My leg hurts right around the area where I got the toothpick shoved into my leg. And the doctor would say, oh, Jennifer, you're just, that doesn't cause pain. You're fine. Why? Why would we tell women that a foreign body doesn't cause pain? It's ridiculous. My doctor wants to do the biopsy of my uterus before surgery and only an ultrasound, not during or after. Should I be worried? Yes. Short answer is yes. Keep looking, because I'll tell you why. There's no need to do an endometrial biopsy unless you have heavy bleeding. If you're having heavy, irregular bleeding, then maybe you would do okay with a biopsy. An ultrasound is never a test for Essure. Never. It might be able to see a coil, but most of the time it can't. There's absolutely no way it's going to see a fragment. Usually doctors do ultrasounds in their offices and they make money off of it. So I'll be perfectly honest. There's absolutely no need to do an ultrasound to locate the Essure. As far as the other reasons they're doing it, I don't know. But it's one of those things where they need to do an endometrial sampling if you're having heavy bleeding, but if you're having normal periods, I don't know the reason for it, unless there's, you can ask them why. It's one of those things I think you just need to do that. There's a SED rate. There's something called an estimated SED rate that can it's kind of a measurement of inflammation, but it's really vague, and it's not a very good test. Any suggestions for doctors who do this well in Michigan? I don't know any. Here's the deal, and I'm not trying to toot my own horn. There's a couple of doctors on the East Coast that have done a lot of these, but I don't think they're doing x-rays during the case. Doesn't mean they're not good doctors. Doesn't mean they're not helping. Doesn't mean they haven't done a bunch of cases. I just don't think they're doing x-rays. And I think you have to do an x-ray if you're taking the tubes out. Michigan, no, but I'll tell you what, you can get a direct flight from Detroit to Austin, and I've done it myself. One trip, and I'll get it done, get them out. Virginia, no, but I think Monteith in South Carolina, I think that's where he is, North Carolina. He does them, but I don't know if Charles takes insurance. I don't think he does, and I think it's about $8,000 or $9,000 total. But he does mostly reversals. I think he does some removals too, but I don't know if he takes insurance. I have no idea. But you can certainly ask. And the hospital you use, it was so nice. Yes, it's a great facility. The other thing about my facility, because it's a surgical hospital and not a hospital, is there's no COVID. We don't have COVID. There hasn't been any COVID in our hospital, so it's COVID free. They test you prior to the case, so we know if you had it, and if you had it, we don't let you in. Sorry. Should they be taking out if I don't have problems? Dana, that's an excellent question. Should you have the Essure removed if you don't have problems? You should have the Essure removed if you want the Essure removed. If you don't have problems and you don't mind having it in, then don't have surgery. No, I wouldn't have surgery. Some women just want to have it removed because they don't like the idea of it being in there and they want it out. And that's enough. That's enough of a reason. No, Kanisha, sorry, I don't know anybody on that far out on the East Coast. Yeah, and everybody's got their reasons and explanations for doing things. But if you have a foreign body in your body and you want it removed, you have it removed. But if you don't have any issues, then I don't have surgery, because surgery has risks. So you don't need to do that, no. But obviously, you can always consult with a physician, and I would say that to everybody. My recommendations here are based on my experiences with my patients. I would like you all to find somebody that can help you. If you can't, I'm here. I would like a removal. Do I need to go to an OB/GYN first, or I can go straight to someone who does it? You don't usually need a referral unless your insurance requires it. If you call our office, 512-956-0296 on Monday, we can tell you if your insurance requires a referral. The only insurances I know that require referrals are definitely state Medicaid plans, and I can only take Medicaid inside the state of Texas. There is a Texas plan that we get called on all the time called Texas Women's Health. That particular plan doesn't cover any sort of surgeries. It just covers birth control pills. And other forms of birth control, but it doesn't cover surgery. That's Texas Women's Health Plan, TWHP. So yeah, great discussion, great questions. Keep them coming. If you have any more, I'll sit on for a little while. Been on here for a little bit, just talking about hormones, talking mostly about Essure removals, especially in light of the news that came out this week. I think it might be worth it to come, not to come see me per se, but to go to somebody that has experience. I know Eric Sills did. I don't know where Eric is. I have absolutely no idea what happened to him. Self-pay is going to be 3 pieces. It's usually my fee, the hospital, and anesthesia is going to run somewhere around $8,000 to $9,000. That's for everything. That's hysterectomy or salpingectomy. They're about the same. Both surgeries have the same incision sites, 3 little 8 millimeter incisions. The surgery time is about the same, and the costs are pretty darn close to the same. Should a woman still have a yearly checkup after hysterectomy? Yes. If you still have ovaries, definitely. If you don't have ovaries, if you've ever had an abnormal pap in your life, it's a good idea to still have a pap smear. If you've never had an abnormal pap, you're with the same partner, I'd still say it's good to go into the doctor once a year just to, you have to have a breast exam, and, you might want to get your thyroid checked or have some other issues checked. But I think it's, do you need the actual pap or pelvic? Well, if you don't have any organs down there, no. But always good to check in. And I'm a hypocrite because I don't go in all the time myself, but yeah, it's a good idea. I think we should all go in probably at least once a year. Dermatology too, get a mole check once a year, especially if you live in a climate that's just got really bad sun or good sun, depending on how you want to look at it. I'm going to see you. I need to save, but I'm thankful. Hey, I'm here. I'm not going anywhere unless I hit the lottery or something, and then I'll retire at that point, but I don't think so. What kind of hormone test should I be asking for if I have ovaries? Hormones. Estradiol, free and total testosterone with a sex hormone binding globulin. DHEA, vitamin D, progesterone, a free T3, which is thyroid, a free T4, and a TSH. Those things are a really good start. You can't really check cortisol with blood. You need to get urine or saliva. Hi, my sister really suffers with her hormones every month, and the doctors only offer her the pill, balance her out. First of all, that's completely asinine. Sorry, I'm trying to see the whole comment. The birth control pill doesn't balance shit. And I'm sorry, but that sucks. That is a sucky thing to say. Birth control pills don't balance anything. What they do is they shut your ovaries off completely. So they're shutting everything off, and they're taking over, and they're using synthetic hormones to do it. So the birth control pills are fine for birth control. But if you're trying to control somebody's hormones, that is complete garbage. And I call that lazy. That is a doctor being freaking lazy. I'm sorry, but it aggravates the hell out of me when women are told that. It's lazy medicine. Doctors that do that are wrong, and I wouldn't do it unless you want to. But if you really want to know what your hormones are doing, get your blood drawn. Know where you are in your cycle when you're getting the blood drawn so we can correlate it, and balance your hormones. Don't take the pill if you're in your 40s and you have irregular periods. That's not helping you. That's not telling you what's the imbalance. That's just turning your ovaries off and shutting everything down. It's not good. That's not what you want. That being said, obviously, I'm not giving medical advice here. I'm just ranting. But I think birth control pills for women that are having irregular periods or insomnia, I think we use birth control pills for too many things. We use them as a knee jerk for PCOS, abnormal periods, fibroids. If they're not being used for birth control, then why are we calling them birth control pills? We're not calling them heavy period pills, I like IUDs. I'm not against IUDs. They are foreign bodies, obviously, so they can cause some reactions. They can cause some pain. IUDs do work really well for birth control. I think they're safer than birth control pills because they don't have the estrogenic quality. And if you're completely opposed to hormones, you can get a copper IUD, which has absolutely no hormones in it. And the good thing about an IUD is that you can have it removed fairly easily if you don't like it. It comes out pretty easily. And if you have it put in, again, with a provider that's put in a bunch versus, I'm sorry, I'm going to say it, versus like a nurse practitioner who hasn't done many, it's a pretty quick process for the most part. It can be a little bit painful, obviously, or uncomfortable, but it's a good option. It's better than birth control pills, but it's not going to. If you have heavy bleeding, sure, the IUD might help, but what is it helping? How do you know what the problem is if you're not checking the hormones? If you're just putting the IUD in, the IUD is going to help with the bleeding, but it may not be fixing the problem. It may just be kind of covering it up again. So you kind of have to look at it that way too. But for a lot of women, the IUD is a great form of birth control, and they enjoy it. About 70% of women that have progesterone-only IUDs don't have periods, and they really like that. Anything else before I shut this show down? This went longer than I thought it was going to because you all have been asking some really great questions. So good to see you. I'm in Boulder, Colorado. I'm heading back on Tuesday, and when I get back, we'll be hopefully taking out some Essures and balancing some hormones. So take care.